Hello, Brad here from 999 KnowHow. In this video, I'm going to be going through the steps of basic life support for adults, an essential skill for any first responder dealing with unresponsive patients in cardiac arrest. I will guide you through the step-by-step process of how to deliver basic life support according to UK guidelines, including performing an initial assessment and using a defibrillator safely. So, let's get started. Basic life support is the immediate care provided when a person's heart or breathing has stopped. It involves chest compressions, rescue breaths, and the use of a defibrillator, which are all performed to help maintain oxygen and blood flow to vital organs until further help arrives. The main steps are an initial assessment, recognising cardiac arrest, starting chest compressions, providing rescue breaths, and using an automated external defibrillator. The first step is confirming that the scene is safe, followed by identifying the patient and assessing their condition. A quick but thorough assessment increases the chance of survival. Always prioritise safety. Ensure the environment around the patient is free from any potential hazards. If needed, move the patient to a safe area for effective CPR. Patients in chairs or beds should be transferred to the floor so effective chest compressions can be administered. Once the scene is safe, approach the patient and assess. Consciousness. Check the patient responds to verbal or painful stimuli. If they don't respond, they're likely to be unconscious. Airway. Check the airway is clear from any obstructions and use either the head tilt, chin lift or jaw thrust method to maintain an open airway. Breathing and pulse. Look, listen and feel for breathing while checking for a carotid pulse for 10 seconds. If the patient shows no signs of breathing or has no detectable pulse, commence CPR. Shout for more help. Ensure 999 has been called while you begin CPR. If you're alone, put your phone on speaker and follow the dispatcher's instructions. To commence chest compressions, place the heel of one hand on the lower half of the sternum. Interlock your fingers with the other hand. Press hard and fast, at least 5 centimeters deep into the chest, at a rate of 100 to 120 compressions per minute, and allow for full recall between compressions. Continue with 30 compressions before moving on to rescue breaths. Rescue breaths. Tilt the patient's head back, lift the chin, and give 2 rescue breaths, each lasting about a second. Wait for the chest to rise to ensure air is entering the lungs. If you can't or are unwilling to provide rescue breaths, continue with hands-only CPR. Using a bag valve mask. Ensure the BVM is assembled correctly and connected to oxygen if available. Check the mask fits the patient's face. Place the mask over the patient's nose and mouth, making sure it seals tightly. Tilt the head back slightly and lift the chin to maintain an open airway. Squeeze the bag firmly to deliver 1 breath over 1 second. Watch for the chest rise to ensure air is entering the lungs. Allow the bag to fully reinflate between breaths. Continue delivering 2 breaths for every 30 chest compressions. Each breath should last about 1 second, with chest rise to ensure air is entering the lungs with each rescue breath administered. Once cardiac arrest is confirmed, attaching an AED to the patient, if available, becomes the next priority. Continue CPR when attaching pads to the patient's chest. Attach the pads as shown on the diagrams. Listen to audible instructions given by the AED. It will automatically assess the rhythm of the heart and deliver a shock if appropriate. Remember, do not touch or move the patient while the AED performs this task. Listen to the AED for further instructions to resume CPR at 30 compressions to 2 rescue breaths ratio. Most AEDs will give voice cues on when to perform rescue breaths and continue with CPR. Before delivering any shock, ensure that no one is touching the patient. Conduct a thorough top-to-toe check and restart CPR immediately after any shock is delivered. Most AEDs will instruct to stand clear before delivering a shock. Remember, swap rescuers frequently to prevent fatigue and maintain high-quality compressions. This is known as the pit stop method. When applying AED pads, always consider the 6 P's. Perspiration. You must dry any excess sweat so the defib pads stick to the patient's chest properly. Pacemakers. Avoid placing pads over any pacemakers. Patches. Avoid sticking pads over medication patches. Adjust the pad placement or remove the medication patch from the patient. Piercings. Don't place pads over any piercings. Puddles. Move the patient to a dry surface. Explosive environments. Avoid using a defib in any flammable areas. Let's review some key terms which relate to basic life support. Cardiac arrest, and this is when the heart suddenly stops pumping blood. Agonal breathing, and this is gasping breaths occurring during cardiac arrest. An AED, which is an automated external defibrillator, an automatic device used to help restart a heart. CPR, which is cardiopulmonary resuscitation, a combination of chest compressions and rescue breaths. Imagine you're in a park and somebody has collapsed. After ensuring the scene is safe, you check the patient for responsiveness and breathing. Finding no response and no signs of breathing, you start chest compressions while someone calls 999 and retrieves an AED. The AED arrives and you follow the 6 P's for pad placement and follow all audible instructions given by the AED. After the AED delivers a shock, you continue with chest compressions, giving the patient the best chance of survival until further help arrives. When further help arrives, be sure to let them know if the AED delivers any shocks and how many times it has done so. Let's quickly recap the key steps to administering basic life support for adults. Recognise cardiac arrest by checking for responsiveness, breathing and pulse. Call for further help via 999 or your Emergency Operations Centre and confirm the person's condition as cardiac arrest. Start chest compressions immediately at a rate of 30 compressions to 2 rescue breaths. Use an AED as soon as it's available, remembering the 6 P's for safe pad placement. Quick and confident action with good CPR and the use of an AED saves lives. Thanks for watching. If you found this video helpful, please like, subscribe and follow us on social media for more life-saving tips and to support the channel. If you have a topic you'd like me to cover next, let me know in the comments.